If you want to understand your kidneys, start with your feet. They're broadcasting urgent messages right now, signals that could spare you from a crisis. Yet most people tune them out. That ankle puffiness, the pins and needles in your toes, the itch that refuses to quit. Each may be your kidneys calling for help. In this video, we're decoding 7 stealth warnings of kidney failure that appear in your feet, so subtle that even seasoned clinicians can overlook them. An estimated 32 million adults in the U.S. are living with chronic kidney disease, and about 3/4 don't realize it. Many assume normal urination equals normal kidney function. The unsettling reality, you can lose up to 80% of kidney capacity before feeling truly ill. And by then, reversing course is far harder. That's why your feet act as early alert beacons, the coal mine canaries of renal health. Research in wound care journals has shown that people with chronic kidney disease consistently develop foot problems that erode day-to-day quality of life. This goes far beyond comfort. The same delicate blood vessels and nerves that keep feet healthy are tightly intertwined with kidney performance. When filtration falters, your feet often suffer first. Spotting these links can be the difference between catching disease early and facing dialysis or a transplant down the line. There's a deeper, more unsettling layer. Foot symptoms don't just warn, they forecast. Every swollen ankle, every numb toe, every shift in skin tone functions like a clock, hinting at the pace of progression and how urgently you need to act. Stay with me. Your feet are about to reveal the quiet clues that could reshape your health trajectory. Let's dive into the 7 hidden warning signs of kidney failure written in your feet. Poor wound, healing on the feet. An inability of the feet to recover from small injuries is arguably one of the most dangerous signals. It reflects the collision of earlier problems: impaired circulation, neuropathy, weakened immune defenses, and metabolic disruption, creating a perfect setup for severe complications. In people with normal health, tiny cuts, scrapes, or pressure spots typically close within days or a few weeks. In those living with kidney disease, those same minor injuries can evolve into ulcers that threaten life and limb. Research shows that chronic kidney disease profoundly slows wound repair. By reducing growth factor production, altering collagen synthesis, and undermining immune function. The cascade often begins with a small injury masked by neuropathy. Without protective sensation, the area isn't offloaded and sustains repeated micro-trauma. Poor blood flow deprives the tissue of oxygen and nutrients, while elevated blood sugar and diabetic kidney disease creates an ideal environment for bacterial overgrowth. The numbers are stark. Roughly 1 in 4 people with chronic kidney disease develop foot ulcers, and about half of those ulcers become infected. Once infection takes hold, a compromised immune system struggles to contain it. What starts as a trivial scratch can advance to bone infection, sometimes leading to amputation. These healing deficits also affect surgical recovery. When foot surgery is required, patients with kidney disease face far higher complication rates, longer healing times, and an increased risk of wound breakdown compared with individuals who have normal kidney function. The result is a damaging cycle. Foot problems demand intervention. Yet each intervention carries an elevated risk of complications. Restless leg syndrome, as if kidney disease weren't burdensome enough. Restless leg syndrome, RLS, often piles on. A neurological torment that strikes up to 60% of people with advanced kidney disease. This is far more than simple fidgeting. It's an overpowering, irresistible compulsion to move the legs and feet, most intensely at night when you're trying to sleep. While the exact mechanism isn't fully mapped, evidence points to a buildup of uremic toxins that interferes with neurotransmitter activity in the brain. Those toxins disrupt the delicate balance of dopamine and other movement-regulating chemicals, producing sensations patients describe as crawling, burning, or jolts like tiny electric shocks in the legs and feet. The timing is especially cruel. Symptoms ramp up in the evening and overnight. precisely when the body needs restorative sleep to cope with the strain of kidney disease. That constant urge to move shatters sleep, unleashing a chain reaction of exhaustion, low mood, and deterioration in kidney function due to poor recovery. What sets kidney disease-related RLS apart is its intensity and its resistance to standard therapies. Many usual medications don't work as well, and because the kidneys clear numerous drugs, those treatments can accumulate to harmful levels in people with renal failure. Patients become trapped in a loop of sleepless nights and drained days. The connection appears bidirectional. RLS worsens as kidney function declines, and the sleep loss and stress it generates may, in turn, hasten disease progression. Studies indicate that kidney disease patients with RLS face higher mortality and a faster path to dialysis than those without this complication. Severe itching of the feet and ankles. Few symptoms are as miserable or as overlooked as the relentless itching tied to kidney failure. Patients often describe it as torment and itch so fierce it robs sleep, provokes scratching until the skin bleeds, and, for some, feels worse than pain itself. This is uremic pruritus, the itch associated with renal failure, affecting up to 90% of people with advanced kidney disease. The feet, encased in shoes and socks and covered by thicker skin, often suffer most. When failing kidneys can't clear phosphorus, the mineral builds up in the blood and deposits in the skin. Elevated phosphorus sparks inflammatory pathways that ignite intense itch, particularly where the skin is thicker, like the feet and ankles. Symptoms frequently flare at night and can intensify after dialysis, feeding a scratch-itch cycle that breaks the skin and invites infection. But phosphorus is only part of the story. Studies in nephrology show that uremic toxins, the waste products healthy kidneys would eliminate, accumulate within the skin and stimulate the nerve endings that transmit itch. In effect, the skin is irritated from the inside out, producing a sensation no amount of scratching can satisfy. The psychological toll is profound. People with severe uremic itching experience higher rates of depression, disrupted sleep, and a markedly reduced quality of life compared with those who don't have this symptom. Scratching may offer brief relief, but injures the skin, worsening the itch and raising the risk of infection. In kidney disease, this is especially dangerous. Neuropathy dulls protective sensation, and poor circulation limits awareness and healing. So patients may scratch without realizing they are creating open wounds. Compromised blood flow then slows repair. Minor scratches can evolve into ulcers. Ulcers become infections, and in individuals whose immune systems are weakened by kidney disease. Infections can escalate to the point where amputation becomes necessary. Skin color changes in the feet. Among the most striking clues are shifts in foot color that expose the silent battle inside your blood vessels, chronic kidney disease, and the conditions that drive it, especially diabetes and hypertension, ravage circulation in ways that often become visible in the feet long before you feel truly unwell. The same vascular damage that injures the kidney's filters also assaults the arteries and veins serving the feet. Studies show peripheral arterial disease is present in up to 40% of people with chronic kidney disease, producing a spectrum of discoloration that maps the collapse of blood flow. When arterial supply falters, feet may look pale or chalky. When venous return is poor, they can take on a dark, ruddy hue. As circulation grows critically compromised, toes may turn blue, an alarm that oxygen delivery has fallen to dangerous levels. This is not cosmetic. It is an emergency signaling tissue on the brink of death. If blood flow continues to fail, patches can turn black, gangrene that may necessitate amputation to preserve life. Not all color change stems from circulation alone. Kidney disease can also drive hyperpigmentation, elevated phosphorus. A frequent problem in kidney failure provokes intense itch, prompting scratching that darkens the skin. The result can be a mottled, uneven tone that many mistake for ordinary age spots. These changes tend to follow a recognizable progression. Early on, you might notice that your feet are slow to warm or appear slightly paler than usual. As kidney function declines, the contrasts sharpen, with clear differences between the coloration of the feet and the legs. By the time blackened areas appear, evidence of tissue death. Overall kidney function is typically below 15% of normal. Chronic foot pain and gout attacks. Foot pain that's easy to blame on age, arthritis, or bad footwear may actually be your skeleton sounding the alarm about kidney disease. The kidneys don't just clear waste, they are central governors of bone biology. When renal function declines, a cascade of hormonal disturbances strips strength from the skeleton, producing renal osteodystrophy. This bone disorder affects up to 90% of people with advanced kidney failure and frequently shows up as persistent pain in the feet. KDOQI clinical guidelines detail how kidney disease derails calcium, phosphorus, and vitamin D metabolism, because failing kidneys cannot convert vitamin D to its active form. Calcium levels fall. In response, the parathyroid glands accelerate output, pulling calcium out of bone to stabilize blood levels. The consequence is bone that becomes weak, brittle, and painful, especially in weight-bearing regions like the feet. A second driver makes foot pain even more ominous: uric acid. Healthy kidneys filter it. Damaged kidneys do not. As levels rise, razor-sharp crystals form and lodge in joints, igniting gout. The big toe is usually the first target, unleashing pain so intense that walking can be impossible. The link between kidney disease and gout is both vicious and two-way. About 1/3 of people with chronic kidney disease develop gout, and having gout increases the risk of developing kidney disease by roughly 40%. Those urate crystals don't just hurt, they fuel inflammation that further injures the kidneys, accelerating decline and amplifying gout flares. Bone pain from kidney disease doesn't behave like typical arthritis or injury pain. It's deep, aching, and unrelenting, often worse at night, and it responds poorly to common pain medications. This reflects a breakdown in the structural integrity of the skeleton, a process that, once kidney disease is advanced, is often irreversible. Numbness and tingling in the feet. Here's where kidney disease turns especially insidious. It targets the nervous system in ways most people never link to their kidneys. Uremic neuropathy affects anywhere from 60% to nearly all individuals with advanced renal disease, as reported in the Brazilian Journal of Medical and Biological Research. When the kidneys can't clear toxins, these wastes accumulate in the bloodstream and injure nerves. The onset is subtle, perhaps a periodic pins and needles feeling in a toe or a faint burning across the soles at night. Many chalk these sensations up to aging or attribute them to diabetes. But the real culprit is uremic toxins progressively damaging the protective sheath around nerve fibers. The longest nerves suffer first, which is why symptoms start in the feet. Nerve conduction studies reveal the scale of this hidden problem. About 70% of people with chronic kidney disease show evidence of peripheral neuropathy even when they report no symptoms. This silent neuropathy is perilous because it strips away protective sensation. Imagine stepping on a nail or developing a pressure spot and not feeling it at all. Minor injuries can evolve into serious, even life-threatening infections. The damage follows a recognizable pattern. It begins in the toes and marches upward, undermining balance, gait, and daily function. Reflexes vanish in sequence, starting with the ankles and progressing higher. Eventually, numbness can become so profound that all protective sensation in the feet is lost, paving the way for amputations that earlier recognition and treatment of kidney disease might have prevented. Persistent foot and ankle swelling. That end-of-day puffiness you chalk up to standing too long or a salty meal may be something more serious. Your kidneys sending an urgent signal. Edema, the medical name for swelling, develops when the kidneys can't effectively remove extra fluid and sodium from the bloodstream. According to the American Kidney Fund, kidney-related edema often shows up first around the feet and ankles because gravity drives fluid to the lowest points. Under normal conditions, the kidneys keep a precise balance between what you drink and what you eliminate. With kidney disease, that balance unravels. Sodium builds up. The body holds onto water to dilute it, and the excess fluid settles in dependent areas, most visibly the feet and ankles. What makes renal edema particularly worrisome is how persistent it is. Unlike swelling from a minor sprain or a one-off salty dinner, it doesn't vanish overnight. Instead, it progresses into what clinicians call pitting edema. Press a fingertip into the swollen area and a dent lingers for several seconds. This isn't just uncomfortable, it signals meaningful loss of kidney function. The progression is subtle at first. Shoes feel snug by evening, then socks leave deep imprints. Eventually, the swelling climbs up the legs. The skin looks stretched and glossy, and becomes prone to breakdown. By the time swelling reaches this extent, kidney function is often below 30% of normal capacity. And that's the takeaway: your feet aren't just carrying you, they're warning you. Swelling that doesn't fade, pins and needles or numbness, deep bone aches or gout flares, color changes, relentless itching, nighttime restlessness, and wounds that won't heal, each is a signal to act now, not later. Do a quick foot check every day. Track any changes. Keep blood pressure and blood sugar in range. Follow your clinician's guidance on sodium and phosphorus. And ask your doctor about kidney tests like eGFR, creatinine, and urine ACR. This video is educational and not medical advice. If you notice these signs, seek care promptly. If this helps you, please like this video, subscribe to the channel, and turn on the notification bell so you never miss new kidney-saving tips. And share this with someone you love. One click today could change their health tomorrow.